My interest in nephrology developed when I was in internal medicine residency, when the pathophysiological mechanisms that are involved in the nephrology specialty has always been very stimulating for me, and that excites me when I'm treating the sickest patients. And this field, I believe, has some of the sicker patients that we treat, though inpatient and outpatient. My granddad, who has passed away a few years ago, he's always been my inspiration. He was a great inspiration for me. He was a doctor. He was a family medicine physician. He practiced in a small village in India, and he helped a lot of poor people, and he treated them for free. A lot of patients who did not have insurance and who did not have money to buy medications and to have very complex treatments. And he provided all the healthcare to those homeless people. So he's always been an inspiration for me. For the CKD patients, we have all the treatments out there. I mean, in order to prevent the progression of the kidney disease, that's what our goal is for such patients, to not end them up on the dialysis. Our goal is to prevent the dialysis for these patients, and would like to get a transplant before they start the dialysis, because the life of the transplanted kidney and also the survival rate is higher when they get transplanted before the dialysis. So my goal is to get these patients to transplant before they end up with dialysis. So we try to prevent the progression. We see them very often in the clinic, every 3 months, 6 months, or sometimes if they're very fairly advanced, we see them every month. We check labs often, and we try to avoid any further kidney injuries. So we talk to them about avoiding changing their lifestyle, or avoiding certain medications, or adjusting the doses of the medications to prevent further injury to the kidneys. So that's my goal again on the dialysis patients. We see them every week, pretty much every day if they have any complications, and we make sure that their access is working fine and they don't have any complications from that, or complications from the dialysis per se. The longevity of the care that we see in nephrology is huge. And that's what I like, to follow up a patient right from the beginning of the kidney injury up until they end up in the dialysis. So I have known them for many years, and then I know them better, so I care for them better. That's what medicine been for me always, not to have short-term relationship, but to have a continuity of care. Hi, this is Sirisha Gudlawar. I'm a nephrologist, and I specialize in point-of-care ultrasound, onconephrology, and I'm looking forward to specialize in glomerular disease and nephrology. And I'm practicing nephrology at Friedrich South.